we're living longer, but we're not necessarily living better. And I think a lot of people aren't aware that there's really a pretty high probability that at some point in the future you'll have difficulty remaining independent, whether that's because of a chronic condition or a cognitive disorder. Frequently there are issues with just basic things like bathing and dressing and those kind of things, not doctors and hospitals, just really being able to remain independent and remain in your own home. There are a number of alternatives available to help people plan ahead to deal with changes in your level of independence and need for assistance. Some of those, such as long-term care insurance, will help you pay for the services you need to stay independent, because services can be very costly. Nursing homes can be as much as $100,000 a year or more. In addition to that, there are retirement communities that people could move to where their needs could be taken care of. I actually think Friends Life Care is one of the unique alternatives for planning ahead for long-term care, because our mission is to help people stay in their own homes for as long as possible. So we both help people pay for the services of long-term care, reduce the burden on the family member, but also make all the arrangements, provide and oversee for all the care you might need to stay independent. Friends Life Care is an option that people enroll when they're still healthy and independent and can function in their own homes. Then an individual, when they enroll in our program, decides how much they want Friends Life Care to pay toward their care and how much they want to pay toward their care. We kind of share the risk. And then when they become a member, we really partner with them as they age in terms of helping them stay healthy and well for as long as possible, identifying when they might have some issues and have some prevention programs that they need, but also if they have a change in health, making all the arrangements and paying for their care up to the level that they chose when they enrolled in our program. The people who are interested in planning for long-term care, or the people who should be planning for long-term care, according to financial planners, you really should start thinking about it when you're in your late 40s, early 50s. Start thinking about where are you going to turn? How are you going to take care of your long-term care needs in the future? So we find that on average people are around age 67 when they enroll in Friends Life Care. So late 50s, early 60s is when people really start thinking about it. We do a lot of informational seminars because, as you can imagine, there's a lot of education that's needed regarding the need for long-term care and what the alternatives are. So that's one of the main ways that we reach out to people, is through informational seminars. The boomers are going to have a dramatic impact on long-term care and how it's delivered. And I can't say they, I have to say we, as I'm part of that generation, really want to control our own destiny. We want to have lots of choices. I don't think we want to, in general, move to communities that are just older people. I think we really want to stay in multi-generational communities, and we really want help staying healthy and well. So I think that all those demands are going to be made. In Friends Life Care, we've started responding to those demands, and indeed we have what we call our Vitality, Independence, Growth, and Resilience, our VIGOR program, to really help the members of our program stay healthy. And we were fortunate to be nationally recognized with an award for that program. But I think that boomers are going to have a dramatic impact on the future of long-term care. I think Gen Xers are starting to become more aware of long-term care, probably because they've seen family members that are struggling with issues of staying independent, and they see the impact that perhaps that had on their own parents who were really burdened with caring for their elderly parents. So I think there is a slowly growing awareness among Gen Xers that something needs to be done. And similarly with the boomers, I think one of the big driving forces behind planning ahead is not wanting to be a burden on their children, not wanting to have the children tell them where they're going to do, what are they going to do with mom and dad. We want to make those decisions ourselves.